in a series of 65 by 65 First Friday webinars. Today, we're going to be looking at the impact of obesity on diabetes. Our presenter is Dr. Catherine Moring. She's the Executive Director of the James C. Kennedy Wellness Center at Tallahassee General Hospital in Charleston, Mississippi. Dr. Moring, we thank you so much for joining us today. Feel free to share your slides, and now I pass the mic to you.
I'm honored to be here today and talking to you about such an important topic. As Sonja mentioned, I'm the Executive Director of the James C. Kennedy Wellness Center in Charleston, Mississippi. And I'm a dietitian by training, and I'm also a certified diabetes care and education specialist, as well as board certified in advanced diabetes management. So I'm going to talk to you today about a really important topic of combating the pandemic and coronavirus carbs, the relationship between obesity and diabetes. So what is the common denominator here? That's the focus of my talk, and I'll go through several different reasons why these are related, and I'll save questions for the end. But if you do have questions, feel free to put them in the chat, and I'm happy to get to them. All righty. I'm going to first just give a little background and prevalence about obesity and diabetes, and then I'm going to talk about the relationship, insulin and insulin resistance, a little bit on carbohydrate metabolism so we understand what's happening in the body that leads to this insulin resistance. And then I'm going to end with a discussion of inflammation in the gut microbiome, because these two things are also very closely related to both obesity and the onset of diabetes. And then I'll end with some questions and discussion. In America, 33% of Americans are overweight. So over a third of us are overweight. Over a third have obesity. And this means that about 70% of us are metabolically unhealthy, leaving only about 20 to 30% of the population that's at a healthy weight. And these numbers are actually much higher in places like Mississippi and the Mississippi Delta. We're seeing numbers as high as 40 and 45% of adults being overweight or having obesity, whereas it's only leaving about 20% of the population at a healthy weight. About 40% have metabolic syndrome. Over 10% have type 2 diabetes, but this is actually a very low number compared to some places. According to the CDC Atlas, in some places, like in rural Mississippi, up to 27% of adults already have type 2 diabetes. 35% have prediabetes. So these numbers added together mean that over half of our population here in Mississippi have some form of diabetes. And this is also true for the rest of the country. It's at about 48%, which is very close to half of American adults having some form of diabetes. And this doesn't even count all of those that already have insulin resistance. And so I'll get into a little bit of that in a little while. And kind of beginning to talk about the relationship here, we know that 90 to 95% of those with type 2 diabetes are overweight or have obesity. So there's only a handful of adults that have type 2 diabetes that are at a healthy weight. And even when we see that, we typically don't see that they're metabolically fit or they're in good shape. So there's some factors going on there. I wanted to talk real quickly about how we define obesity and why. And so when we talk about someone's overweight or someone has obesity, I'm sure most of you are familiar with this, but just to give you a better idea. So we can use two measures. One is body mass index, and the other is waist circumference. So body mass index is the relationship of a person's weight to their height. And basically, as your weight goes up, but you stay the same height, you begin to gain weight and you get into this category of overweight or obesity. So for a person that's 5'5", according to BMI, if you were 155 to 180 pounds, that would be considered overweight. If you're over 180 pounds, that is considered having obesity. For someone 6 feet, 185 to 220 pounds would be overweight, and 225 or above would have obesity. This measure is fine. It's easy to calculate, but it has a lot of cons to it. It's not the best measure to use, especially because it treats men and women the same. And we know that men and women have different body types, different muscle types. I used to teach undergrad students at Ole Miss, and I used to have a lot of football players. And when we used BMI, they would all notoriously be obese according to the BMI because of their muscle mass. So I really like to use waist circumference. Waist circumference gives us a better idea of what's going on in the most important area of the body, which is around the visceral, around the organs where we carry this visceral fat. So that fat is much more, puts you at much more risk for insulin resistance and poor health outcomes as compared to like subcutaneous fat that we might carry under our arms or on our thighs or on our hips. So waist circumference, we want this under 35 inches for women, under 40 inches for men. And ideally you want your waist circumference to be half of your height. So that's a really good way to think about it. So, if you're 5'4", you're 64 inches, you want your waist under 32 inches. So that's going to be a better measure there to dictate overweight and obesity. All right, so quickly on metabolic syndrome. So this presentation is on relationship obesity and diabetes, but I wanted to mention this because what I see a lot of times is that people may not actually clinically have diabetes. So they don't actually have elevated blood sugar, but they have everything else going on in the background, including insulin resistance, which is actually just as serious as a health concern as diabetes, because we know that the number one cause of death in this country is heart disease. Number two is stroke, and heart disease and stroke are 99% of the time related to this insulin resistance going on in the body, maybe 95% of the time. Of course, we have that genetic component too. So what is metabolic syndrome? Metabolic syndrome is having three out of the following 5 things. So if you have a waist circumference greater than 35 for women or greater than 40 for men, a low HDL, so an HDL under 40. And this is also kind of combined with a high LDL, high total cholesterol, high triglycerides, if your triglycerides are over 150, if you have high blood pressure, so over 130, over 85, and if you have high blood sugar, so a blood sugar over 100. So actually in the pre-diabetes range qualifies you for metabolic syndrome. Other things associated with this, I'm not sure, some of you may have heard that they're beginning to call Alzheimer's that's associated with metabolic syndrome type 3 diabetes. And this has to do with insulin resistance of the brain and the inability of the brain to be fed, because the brain can't store glucose like the muscles can. The brain has to have constant glucose transport. And so when our cells become insulin resistant and the brain can't get fed, we start to see Alzheimer's and dementia show up. We do know that insulin is predicted to be, high insulin levels or overweight and obesity are associated with 13 different cancers, as well as polycystic ovarian syndrome, which is essentially insulin resistance of the ovaries. It's a lot more complicated than that, but we do see some relationship there. And a lot of these women do go on to develop diabetes later in life. And then, of course, the relationship to non-alcoholic fatty liver disease. It's really hard on our liver when we have insulin resistance and when we consume more or less too much processed refined carbohydrates. So this is really important to understand. So as I mentioned earlier, we have all these statistics about how prevalent diabetes is and how much it costs and all of these things. But really, we have a whole subset of the population that's also at risk for all of these other things outside of the fact that they might just have a pancreas that's able to keep up with insulin production and keep their blood sugars down. Obesity and type 2 diabetes are intricately related. They rarely exist. Type 2 diabetes rarely exists in the absence of overweight or obesity. There's every now and then, but even in, I have worked predominantly with diabetes. That's our area of expertise here at the center. And I would say of my client pool, I've got 1 or 2 that don't necessarily qualify as overweight or obese, but they still have a lot of excess fat around the abdominal region, and they're not in good shape. And so we see that those 2 things go hand in hand. How much are you exercising, and then what's your body weight overall? And then, as I mentioned earlier, only about 5 to 10% of those with type 2 diabetes are at a healthy body weight. And why is this the case? So what is the relationship here as to why they are so intricately related? And the answer comes down to insulin and insulin resistance. And someone becomes insulin resistant long before they have diabetes. In fact, we can predict that 10 to 20 years prior to the onset of diabetes, we could have done an insulin, baseline insulin, fasting insulin test, and seen that these individuals actually begin to have elevated insulin levels. So from the triumvirate to the octet. So we used to think about hyperglycemia or high blood sugar being related. We knew that it was related to 3 things. Impaired insulin secretion. So this is where the insulin resistance comes into play. So the body's inability to make enough insulin. So the pancreas isn't making enough insulin to keep up with the blood sugar levels. And then second, we have decreased muscle glucose uptake. So our muscles aren't using as much sugar, either because we're not as physically active, or we have too much stored in there, and there's some insulin resistance going on at the muscle level. And then we have the increased liver glucose production. So this is the hepatic glucose production. So we think about our liver when we're in a fasted state and we're not eating food. Our liver is responsible for overnight keeping blood sugar levels balanced. And so the liver releases sugar into the bloodstream. When we get diabetes, it likes to party all night. So all of a sudden we have these really elevated fasting blood sugars. And so that's going on. This is how we first understood type 2 diabetes. But now we know there's actually 8 things happening that go on in the body that are leading to this development of high blood sugar. And most of these are related to the insulin resistance and the body, the weight gain and the obesity. And I'll come back in just a minute and talk about what the relationship is there. But to just point out a few of these, we've got increased lipolysis going on. And so insulin resistance is associated with this. Again, we've got increased glucagon secretion, we've got decreased insulin secretion, and then there's this decreased incretin effect. Again, all of this happens to be related to the insulin resistance. So this is just, I want to just talk us through real quick what happens when we eat a meal. And so this is getting into the explanation of why overweight and obesity are related to diabetes. So let's say we eat a meal, we eat a hamburger and some fruit and some French fries, and that meal is digested and our intestines absorb the sugar. And so then what happens is, as this meal is being digested, you can see the purple little dots, the glucose entering the bloodstream. Excuse me. So this happens in everybody. The pancreas senses that and then releases insulin to bind to the sugar and take the sugar to the liver, the muscle, and the fat cells to be stored for use for energy later. And then we get back to this level of homeostasis, which is where we want to be. The problem occurs when the insulin, the body is not able to bring the sugar into the cells for energy because the cells have become insulin resistant. And the reason this occurs is because we have an overconsumption of processed refined carbohydrates. So you can think about this like a suitcase. If you're packing your suitcase, and at first everything fits in really easily. So we're children, we're young adults, we have plenty of storage capacity for these carbohydrates that we consume and this conversion into sugar. And so what happens over time is we eventually run out of space in our suitcase, right? Or you're filling up your car tank and your gas. If you fill up your tank and it reaches maximum capacity, it starts to overflow, or the suitcase starts to overflow. Well, our cells are the same way. They start to overflow, and they know that if they take on too much sugar, they're going to become oxidized and die off and become damaged. And so they have a protective mechanism where they can shut off their receptor site to not allow insulin to bring any more sugar into that cell. Well, this is where the overweight and obesity comes into play. Insulin's job is to take that sugar into the body cells or get it out of the bloodstream. It's got to do something with the sugar. Well, when it can't get it into the cells because the cells are insulin resistant, it begins to change that sugar into fat through the process of lipogenesis. This is where we get increased triglycerides, poor hyperlipidemia, poor lipid profile. And so the body then, insulin's able to basically store sugar in the form of fat. And this is when we begin to gain weight because we have a storage problem. And the body has become excellent at storing food, storing energy. In fact, a non-overweight human can live on average of 30 days without eating any food because of our fat stores. And so we think about that. And so the human body can theoretically gain more and more and more weight. And so we just increase our fat cell size, the number of fat cells, as a way to store this excess energy. And so what that looks like is you can imagine, so this person on the left, and then what happens is, so when we start to become insulin resistant, the pancreas secretes more and more and more insulin to try to get that sugar into the cell. And so I like to give this example. Imagine you're at a hotel and you go to get on the elevator and you're with your friends. And in this analogy, the elevator is our body cell and the bellman is insulin. And so the bellman, his responsibility is to get people on the elevator. Insulin's responsibility is to get people get sugar into the cell. So the elevator door opens and it's packed so full of people, not even a baby can fit. but the bellman's like, hey, come on, get on, there's plenty of room. And you're like, no, there's not. And the elevator's like, no, there's not. So the elevator's thinking, if we listen to this bellman anymore, we're going to break. So it shuts off its door and won't open for the bellman. So the bellman goes and gets a bunch of his friends to try to pry open the door to let these people on. Well, the body's similar. When the cell shuts off its receptor site to insulin, then insulin, the body produces more and more insulin to try to basically pack in the sugar. And so this is where we get insulin resistance. So on the left here, this is someone who's insulin sensitive. So they ate that same meal from the previous slide, the hamburger, fruit, and fries. And the majority of that meal is carbohydrate, except for the cheese and the burger. Everything else in that meal is carbohydrate. So in this person on the left, you see it only takes this much insulin, 5 little dots of insulin, to drive all that sugar into the body cells for storage. On the right, however, it takes 5 times as much insulin to get the same amount of sugar into the blood cell. And this is where the weight problem comes into play, because insulin is a building, storing anabolic hormone. And insulin is 2 times in our life where we're naturally insulin resistant is puberty and pregnancy, because we're growing during those times. Well, an adult, American adults, most of us don't really need to grow anymore and gain weight. But when we have insulin resistance, it's driving this weight gain because of the way insulin acts. It promotes fat storage. It prevents lipolysis. It constricts the blood vessels. It can lead to all sorts of things. On my next slide, I'm going to show you some things related to insulin resistance. But this is the real thing to understand about why weight gain is associated, why obesity is related to diabetes. And it's because of this elevated blood levels of insulin. So when people start taking insulin, they typically gain weight because, again, it's a building, storing anabolic hormone that is related to our body's ability to store fat. So I wanted to just share quickly some effects of high insulin in the body. A lot of times we think it's really, really, really important to treat high blood sugar, which it is. High blood sugars are very dangerous, but it's equally important to think about. We don't want in the background these just massive levels of insulin either. So insulin is not always the best answer for treating type 2 diabetes. We really want to think about diet, because this is a disease that is 95% related to diet and lifestyle. But high insulin causes high blood pressure, high triglycerides, muscle weakness. It causes vascular constriction, which drives the high blood pressure. It's causing increased inflammation, cancer, weight gain, brain fog, all the things. So how do you know if you're insulin resistant? One thing you can do is look down at your belly. And if you have increased weight around your belly, or if you have brain fog, or you get fatigue, or you have high blood pressure, or you have an A1C above 5.5, or a fasting blood sugar over 100. These are all indicators that you have elevated blood levels of insulin, and that you're probably likely at risk for heart disease, stroke, and a lot of women, things like other autoimmune related conditions because of the inflammation going on in the gut. So these are important to think about. So what does food have to do with this? Okay, what does food have to do with it, and why are carbohydrates, talked about so often? And it's because carbohydrates are the main way our body gets sugar from energy. Gets energy. And so what happened, it's the main way our blood sugar rises. So when we eat carbohydrates, we get this major spike in blood sugar, and 90 to 100% of carbohydrate turns to blood sugar. It turns to sugar in the bloodstream. Whereas you can see protein, about 50% turns to sugar, and fat, hardly any ever turns to sugar in the bloodstream. So this is why we want to really think about eliminating, especially processed refined carbohydrates from the diet. Really everybody could benefit from a low carbohydrate diet, but especially people with insulin resistance, and especially those with type 2 diabetes, because of the way carbohydrates act. So you can see here again, you get this spike and fall. The other problem with this spike and drastic fall is when your body's blood sugar starts to drop, the brain thinks we need more sugar. So you just have this constant interplay of craving sugar, because your sugar's dropping. And so you just get on this blood sugar roller coaster all day long. So I really want to try to limit the processed refined carbohydrates, because if blood sugar is not spiking, the body doesn't need as much insulin to take that sugar out of the bloodstream. If you're eating foods that have hardly any impact on blood sugar, then you're going to have hardly any insulin response. And so then you can basically get people off the elevator and make room for more people. And so you can address this insulin resistance that way. Another thing that drives obesity and therefore diabetes is inflammation. And so we got to think about this in terms of how the body responds to food. So when we consume food, the body doesn't recognize as food. So if you turn your food label over and there's 17 things in the ingredients and you don't recognize most of the names, that's probably an inflammatory food. Okay, these processed, man-made bags and boxes of food are not great for our health. And so it typically, a lot of times, inflammation is started in the gut because this is where the majority of our immune system resides, and we get this dysbiosis or imbalance of imbalance of bacteria in the gut. And I'll talk a little bit more about that in a second. So there are 6 things that are really drivers of inflammation in the body: inflammatory oils, which is soybean, canola, vegetable, and corn oil; dairy, grains, particularly gluten; sugar, legumes, and alcohol. And now it's tricky because they're not all inflammatory for everybody. And so I always tell my clients, our goal is to have the least restrictive diet possible, but we really need to find out for you what's triggering your inflammation, right? And so you can kind of do that through like elimination diets. So the gut microbiome, this is a really important aspect of this. So the gut microbiome refers to the interplay and the makeup of the viruses, the bacteria, and the fungi that live in our gut and our immune system. In the human body, there's about 3 to 5 pounds of bacteria in our gut. And we didn't know about the microbiome really much at all about it till about 10 years ago. And this is a really fascinating area of science that I think we're just going to be it's going to be fascinating what we learn in the next 5 to 10 years. But we do now know that decreased gut diversity, meaning that the decreased amount of the variety of things in the gut, is associated with diabetes and obesity, as well as a whole host of other conditions related to autoimmune conditions. And so we see things like IBS, I'm trying to think of some of the other ones: anxiety, depression, heart disease, diabetes, all these different chronic health conditions. Oftentimes we can relate to what's going on in the gut. And if we clean up the gut, we clean up the diet, we address this insulin resistance, we can help get to a healthy body weight, we can help get back to a place where we're insulin sensitive, where we don't need as much insulin as our body responds to blood sugar, and we can help fix the gut in terms of cleaning up what's going on there. And so this is a really important thing to consider too. And I would encourage all of you to really talk to your patients and your clients and others about this, because most people aren't aware that when we consume food that the body doesn't recognize as food, it creates this inflammation in the gut. And so we can think about this as like chronic, long-term uptake immune system activity. And so what happens is, if we consume food and it passes through the GALT, which is the gut associated lymphoid tissue, and that's where a lot of our immune system is housed. And it's something like, Captain Crunch, or, Doritos or Oreos, or things that are just a lot of different chemicals, a lot of different processing, particularly like soy, gluten, and dairy products for some people. This is going to create this inflammation. And so then you're really disrupting the gut microbiome, because the immune system is turned on and feels like there's like invaders. Then it leads to leaky gut, and then you get the inflammation in the bloodstream. So there's a real close relationship between inflammation, insulin resistance, and then obesity and diabetes. And so it's really important for us to understand primarily how insulin resistance is occurring. And of course, this is coming back to this idea of inflammation and consuming foods the body doesn't recognize as food. And so then we get, again, the storage problem. So we eat our whole lives the standard American diet of waffles and cookies and pasta and all the things like that. Blood sugar is constantly rising, constantly elevated. Insulin's constantly having to come in and get it. And so at some point, our suitcase gets full, our elevator gets full, our gas tank gets full. And we really got to think about burning off that excess fuel, because we have a storage problem. And so then what happens is we begin to gain weight because the body's insulin resistant, but insulin's got to do something with that sugar. So it begins to change it into the creation of new fat through lipogenesis. And we gain weight because theoretically, again, humans can gain endless amounts of weight. So I wanted to just end with what's good. There's been so much controversy in the dietary world. I'm a registered dietitian, and even amongst a lot of dietitians, there's controversy. So I can imagine how challenging it is for the public when, eggs are bad, eggs are good, peanut butter's bad, peanut butter's good, don't eat meat, don't eat plants, eat carnivore, eat vegan, like it's crazy. So I just wanted to leave you with things that we do agree on. High quality wild caught fish. That's a great source of fat and protein. Things like tuna, salmon, eggs, good quality eggs, nuts and seeds, well-raised meat. So trying to find things that are not necessarily from, feedlots, but, good quality, high quality meat. Dairy for some people. Dairy is not inflammatory for everybody, but for some people it is. good, healthy carbohydrates. So we can all agree that the carbohydrates that come out of boxes and bags are not healthy, but things like fruits or certain fruits and vegetables and peppers and lemons and grains like quinoa and things like that are excellent. Lentils, excellent choices for you. And adding things like ginger and turmeric and garlic to your foods for that increased vitamin and mineral content. And then healthy fat. Really want to focus on a healthy fat over some of the other unhealthier fats. So things like avocado, healthy oils like avocado oil, coconut oil, olive oil. These are all wonderful options. Eggs, nuts, seeds, olives. Awesome. So I just want to end with saying, let food be your medicine, and understand that food can be your medicine, because every time we eat, we make a choice to either improve and increase our health or combat our health. And so food really is either medicine or poison, depending on what you're putting in your body. And every time we eat, we make a choice about what you're telling your body, because food is information. And every minute our body is making millions of new cells, and that cells and the makeup of our cells is directly impacted by the type of nutrients you give your body. And when we eat a very high inflammatory diet, it leads to dysbiosis in the gut. When we eat a very high carbohydrate diet, it's going to lead to insulin resistance because we get this storage capacity problem. And then we're eventually, even if you don't develop diabetes and obesity, even if you don't develop diabetes, you are likely going to develop things like cancer, heart disease, stroke, Alzheimer's, and other conditions related to this insulin resistance. All righty, so that is all I have. I left a couple of minutes for questions. If anybody has any, I'll check the chat real quick. But my information's there. Again, my name's Catherine Mooring. I'm the executive director of the James C. Kennedy Wellness Center, and I specialize in diabetes and obesity as well as autoimmune conditions. So if you have any questions, or after the fact have somebody that could benefit from our services, we are telehealth based, so we can really help anybody anywhere. All righty, I'm going to stop sharing so I can answer any questions. I don't think there's
Dr.
anything.
Mooring,
Okay.
yeah, there is nothing in the chat, but thank you so much for that presentation. Perfect timing. And you really did kind of hit me over the head with, this is things you really need to pay attention to. I loved your make it plain analogies. So thank you so much for the information. And yes, we do have another minute or two if anyone has a question for Dr. Mooring. This has been a great presentation on the impact of obesity on diabetes.
Well, thank you. It was a pleasure to be here. And like I said, if somebody's watching it after the fact, feel free to reach out to me. I'm happy to answer any questions or explain anything further for sure. So it's an honor to be here with you guys today.
We look forward to seeing you all again for our 7th in our series in July. Thank you. Have a great day.